I'm Mark Zalkovic, a general surgeon in the private sector and a flight surgeon with the U.S. Air Force Reserves. We're going to talk about some simple wound closure today, and we're going to show you several techniques to close some simple wounds on the skin. Our first setup is our instruments. We have what's called a needle driver and a set of tissue pickups. Our first thing is just handling the needle driver. Your fourth finger and thumb go into the needle driver like so. And then we're going to load the needle right in front of us. The needle is loaded about 3/4 of the way back on the suture. So the key for this one is making sure we come equal distance on each side of the wound and coming in at a right angle and just letting the needle do the work. So the first technique we'll show you is just a simple suture closure. So we come on one side, equal distance on the other side, push it through so we don't grab the tip of the needle, but we have enough to pull through following the curve of the needle. And we're going to pull this up to leave a little tail. And our first suture that we're going to do is what's called a surgeon's knot. So we're going to come on the inside of the suture, wrap it around twice, grab the tip of our tail, and come down so it lays flat, pulling it tight enough just to approximate the skin edges. We're going to come on the inside again and just wrap it around once, grab our tail, and pull it through so it comes down nice and flat. And that's a nice square knot. For this type of suture, we're going to put in about 5 throws, coming on the inside each time, and just having a kind of a back and forth motion so this lays nice and flat. And then cut the tails. Once again, just be careful with your sharps, either using your tissue pickups and once again reloading the needle. Our next one is going to be roughly about a centimeter or so apart from our first one, depending on the size of the wound and the gape of the wound. Coming once again about equal distance on each side. And putting our surgeon's knot, which is 2 throws, and having it come down nice and flat, just approximating the 2 skin edges. So once again, inside, grab the tail, and it's just a back and forth motion so this cut lays nice and flat. And we cut our tails. And you would do that all the way down to close this entire wound. And that's a simple suture. From this point on, I'm going to show you how to do what's called a running suture or baseball stitch. So we're going to start where we left off, but typically you would use this on the entire wound. So the starting point is the same as the simple suture. Oops. Equal distance. 2 throws are a surgeon's knot. And either, once again, load it in front of you, making sure where your sharps are. And then coming on equal sides. Once again, a running stitch, or what's called a baseball stitch. And we would do this all the way down till the wound is closed. And then toward the end, we come close to our last suture, and we're going to close this by using this loop. Two throws again, pull up, and once again so it lays nice and flat.